For this injection, the following armamentarium will be needed: a yellow cassette with a mouth mirror and cotton pliers, a needle capper, a syringe, 2x2 cotton gauze, 25 gauge long selection, a cartridge with solution appropriate for the patient with or without epinephrine, 20% benzocaine topical anesthetic, and optional Q-tips. Before administering this block, the cartridge must be loaded with the top portion in first. Be sure that the barcode is pointed away from the large window and the clinician is able to clearly read the information printed on the cartridge through the large window. Provide one strong twist of the syringe so that the harpoon is engaged, and never pop the harpoon with the palm of your hand. Check that the harpoon is engaged by carefully pulling back slightly on the thumb ring. Carefully twist off the bottom portion of the needle and attach it to the head of the syringe. Twist the needle into place until snug. Be aware of bevel placement for your specific injection. For the lingual block, the nerve anesthetized is the lingual nerve. The areas are the lingual tissue, the anterior 2/3 of the tongue, and the floor of the mouth to the midline. Landmarks for the IA are the anterior border of the ramus, the medial surface of the mandibular ramus, the pterygomandibular fold, the pterygomandibular space, the coronoid notch, and the mandibular occlusal plane. At this point, apply the 20% benzocaine topical anesthetic to your insertion point. For this injection, we will be using a 25 gauge long selection and administering 0.3 milliliters of solution at a depth of 10 to 12 millimeters. The point of insertion will be 2/3 to 3/4 the distance from the coronoid notch and the posterior border of the ramus, and at the middle of the pterygomandibular space, roughly 6 to 10 millimeters superior to the mandibular occlusal plane. The lingual injection is given similarly to the IA block. Once osseous contact has been reached, withdraw halfway, roughly 10 to 12 millimeters, and aspirate one time. Then administer the remainder of your solution. For the lingual block, you will be administering 0.3 milliliters of solution, which will look like this. Be sure to thoroughly rinse your patient and dispose of the needle and cartridge in their respective bins. Let your patient know where they should be expecting numbness to occur. Post-operative instructions should be provided to the patient by the clinician, such as, while numb, please be careful not to bite your lip, cheek, or tongue. No hot temperature food or beverages, no crunchy foods. Please stick to a soft food diet until the numbness wears off.